do you need to get consent on everything? Right? Pretty much, if we really try to think about it, if you're walking down the street and somebody grabs your hand, okay, and tries to put an IV into you or stick a needle into you, it's an offense, right? So you're causing harm, and the person on the street that you grabbed didn't give any consent, right? So we go to the idea of the general consent. If you're entering the hospital or entering a clinic or medical care institution, there's the general consent, and there's specific consents for particular actions or inactions or procedures. So the general consent is what happens when you go into a clinic or the hospital and someone gives you a form, and part of that form is actually consent to treatment. And this usually covers things that don't cause a lot of harm. So you might call them routine stuff. Like, for example, you're admitted in the hospital and, obviously, the nursing attendants or the caregivers in the hospital or the nurses would need to help you eat maybe, or take a bath, or administer medications if you're sick. That's the reason why you're there. Maybe check your blood sugar. Nobody goes in your room and gets your consent for glucometer checks, take your blood pressure, temperature, very simple procedures. And obviously you don't see people getting consent for each and every procedure. Now, assent is different. Assent would be recommended. Like, before you start sticking an IV on the patient's arm, you at least should explain to the patient what you're doing and what it's for, and that would be an assent. But the patient already signed a general consent. So these are routine stuff. Now, if you're dealing with significant risks or material risks, that's a common legal terminology, material. Let's not go into that yet. Let's just use the word significant risks or significant discomfort or potentially serious side effects. Then that's not considered routine anymore, and that's not covered by the general consent. Those things require specific consents. That's the reason why even if the patient has already signed the general consent and the surgeon wants to operate on the patient, they still have to get the consent for that particular action. Okay. And what about morphine? Well, morphine is the hazy part. If the doctors feel like it's not clearly accepted by all the doctors, there's varying opinions about the use of morphine for unstable but terminally ill patients. Well, at the very least, you should get an assent if you feel like, it's pretty well established, but the patient might not understand. And of course, that's the reason for that is to avoid conflicts or troubles. Now, if it's really hazy, then you might decide to get a consent, sit down, tell the patient about the morphine, possible risks, side effects, what you're planning to do, and legally ask them if it's okay. So that's a legal consent. And usually you do that to protect yourself from any legal questions or legally based problems later on. Okay, so if somebody questions it, you can say, well, I told the patient about the risks, and, she understands, and it's well documented, and this is how I document it. So we'll talk about documentation some other time, like proper, complete documentation. And the patient signed it, and there's a witness, and you're safe, right? So there are gray areas, and of course, there are obvious areas where you really get consent, and there are gray areas where some doctors might want to be on the safe side and get consent, like those morphine situations. But those are the specific consents for an action or an inaction. Okay, so the general consent and the specific consent. Now, what you shouldn't do and what's questionable is you put everything inside the general consent. You can't do that. I mean, it doesn't work. I've seen some questionable or morally questionable institutions trying to get away. Of course, they feel like it makes things more efficient. Like, you give the patient a form that lists down everything, the routine procedures and the non-routine procedures all in one paper, and then just sign it. Now, why is that not legally acceptable? Well, for one thing, everything is just written down, even the non-routine procedures. Nobody sat down, told them their clinical situation, told them about the risks and the benefits of that particular. If things carry significant material risks or potential for harm, then that's the kind of decision where the doctor needs to sit down and give the patient sufficient information about that very significant decision. You can't just put that thing on the list and say, well, it's on the list, so we're okay. No, because that's not valid. The patient can always say, well, it's on the list, but I didn't understand it. They just handed me the list and then it's here and they haven't gotten the test yet. So, how can I decide on this particular surgery, even if it's on list number 10? You see, it's crazy, actually stupid, but I've seen it done in the past, hopefully not right now. So that's the idea of general consent, or the general consent to treatment forms and specific consents for actions or inactions.